So we're here with Ben Jensen, physical therapist at Dry Creek. Wonderful presentation this morning. Ben, you and I have worked together for quite a long time now. It was interesting, I was thinking about how long it's been, and I think some of the very, very earliest rounds, discussions, conversations that we've done, you've been a big part of, so really appreciate your support and insight. I wanted to ask, just you talked about the Wright brothers at the beginning of your discussion. What do the Wright brothers in aviation have anything to do with medicine?
Great question. It's just interesting. Wilbur Wright had a major health problem when he was young, and his life was kind of laid out. He was going to Yale, he was going to be a minister or law school, and he had this injury. It was a hockey accident, and I think it was a crucial moment in his life where things could have turned one way or the other. And he was honestly had a lot of depression during the time. He had about 3 years in which he really was kind of in this tough spot. But during that 3 years is really where life changed for him. He was able to pivot from that and find new meaning and really go on and do obviously incredible things. But I thought of that as we work with patients. I think of many times that they run into very tough moments in their life, and the importance of helping them see that there can be new meaning, and we can find new purpose, and hopefully we can provide the tools to be able to give them on that pathway.
I think it's a great story, this idea of pivoting, and maybe things change, maybe there's a roundabout course to get where you want to go because of a setback. Oftentimes you and I are there with patients at a moment such as Orville had, where they do need to pivot, and what if he hadn't had the hockey accident? I don't think we would be talking about him.
Yeah.
If you could prescribe one thing for patients to help them with their health, what would it be?
One of the most powerful tools that we have is just motion, exercise. Just the very foundational principles of our bodies. We need motion, and we move, we have better health. And I think just helping our patients have kind of some parameters to work with is very, very important, to know that the more we move, the better health we'll have within, and giving them the tools to be able to know that is crucial.
Mm-hmm. Yeah, there's sort of this saying that food is the best medicine, which is probably true, and then exercise is the best medicine, which is also true. And I think if you put them together, I think good nutrition, good movement, and exercise is when I think people can live probably their best lives and be as healthy as possible. How do you take this example from Orville's, the idea of pivoting, and a patient that has pain and has suffering and it's painful to move? How does that play a role in the thought process?
For one, I think individuals are ready to learn. They're ready to see. They're at a teachable moment. So I think that we have a great stewardship as healthcare providers to be able to provide them a pathway that will give them new meaning and a new purpose, or regain of what they had in the past. But when we run into those moments, we have to be able to chart a course for them that works with where they're at. Someone may not be able to go out and run anymore at that time. They may not be able to, sit. They may not be able to lift weights, but they can. Those are a lot of things they can't do. But we can show them the things they can do, and provide other means, other opportunities to be able to increase their heart rate, other opportunities to move, other ways to be able to get and regain what they had before, or find new meaning.
Mm-hmm. Yeah, I love that. And even if a patient is, maybe they're even preparing for surgery and they're in pain, we still want them to especially work with physical therapy, but find creative ways to stay moving and stay active. Another really wonderful thought process in the discussion was, what are you preparing for? And how does that play a role in our mindset what are you preparing for?
I think it's a question to ask to self-reflect. If you look at yourself, but also ask your patients to look, what are you doing on a daily basis?
Mm-hmm.
And what are you preparing for? If you have someone that may be sitting a lot or not moving much, literally what are you preparing for? And your body will adapt to what you do.
Mm-hmm.
And it'll adapt to the challenges we place upon it. Helping them see that maybe what you're doing is not necessarily good for your long-term goals. And I think trying to work with them to help define how to get there is important.
Mm-hmm. That's great. I love this. We work with a lot of great physical therapists. Your leadership at Dry Creek has been amazing, and the physical therapists across the board at Dry Creek are wonderful. But I just love that relationship that a patient can have with physical therapy, and this idea that we want to keep you moving. Let's define what we're preparing for, and the ability to pivot a little to accommodate for setbacks, pain, and other kinds of things that happen in life is such a great thing. And really appreciate the time you spent this morning in the discussion, and just over the years, all the support and the work that you've done for the patients.
Well, it's been an honor. We appreciate the opportunity, so thank you.
Thank you.